Hello everyone, I'm Dr. Merkle. Got some great information for you today on ulcerative colitis, Crohn's, or any severe digestive problem like that, maybe just regular colitis. But this will definitely help. If you have it, it's going to give you some ideas. If you know someone that has it, they need to hear this information. I want to get right into it. There is a doctor that we work with that has a patient with ulcerative colitis. Dr. Brian commented, she's bleeding regularly. She's in and out of the hospital doing infusions. She did the testing. We put her on the supplements, but she stopped because the bleeding was not improving. What should we do? All right, now whenever we get questions like this, I always go back and look at the test results, try and get some information there, some things that I can then provide to help them with good information. We look at the reports when doctors are asking questions so we can get some better information on what's happening. And this is the report, the most recent report for this patient. Now it's time to get retested. I'm going to make some recommendations on testing, but let's see where this patient is and see if we can get some information just by reviewing what the doctor already has. All right, well, here's the tests that were used in this analysis: a blood test, a dipstick urine test. The PSS is Patient Symptom Survey, medication, and vitals. And here's the patient, 46, 5'2", 133 pounds. And these are her primary symptoms: ulcerative colitis, anxiety, menopausal symptoms. And here are some things that she checked off, some problems that she has, or just overall health and lifestyle. And you can read through that. I'm not going to go through every word of this report. I'm just going to hit the highlights. Now, here are the primary findings. These are actually the objective findings found on the testing that was done. She's on many medications. Now, some of these are just occasional, but some of these she's been on for a while. And the thing you always want to look at on the medications are the side effects of the meds. Now, interestingly about medications, they only study one medication at a time for side effects. And studies have shown that when you add 2 drugs together, 3 drugs together, 4 drugs together, you get a multiple, not just an additive effect of side effects, but you get a multiple of side effects. So we have no idea how each person is going to respond. What I always want people to do is to let's just look at the side effects of some of these. Acetaminophen, known as Tylenol, for minor aches and pains. It can cause diarrhea, constipation, abdominal pain, nausea. Could be contributory with ulcerative colitis. How about Adderall? What do we see here? Do we see anything associated with poor digestion? Well, there's diarrhea again. Okay, see how we're getting something here? Alka-Seltzer is for digestion, but sometimes it causes problems. Here we have Benadryl, and it can cause upset stomach, irritability. Bentyl, let's see, what can it cause? We get the idea. These drugs individually have symptoms similar to what she has with ulcerative colitis. You'd think that these symptoms could be magnified being on so many drugs that can contribute toward those things. And we have Botox. You can read the side effects of that. There's many here. Eliquis, oh, this is one. Eliquis, to reduce blood clots. It thins the blood. And this is very important. We'll see that this thins the blood. It can cause black, bloody stools. Sounds like ulcerative colitis, doesn't it? Bleeding, unusual bleeding. Now think of these blood thinners. When you're on those, you have to worry about bumping your arm, or you notice that you bleed easily. You'll see bruising on your skin because it makes capillaries fragile and they don't stop bleeding like normally. So if you're seeing this on the outside of your skin, guess what? It's happening inside too. In fact, if you think about it, it might be a little bit of a weird thought. Your colon is actually, some people think of it as internal skin because what's in your colon doesn't go into your body. It's going into your mouth and it comes out your colon. So if it affects your skin, don't be surprised if this drug affects your colon. and causes bleeding. Ulcerative colitis. It is true. If you see bruising on your skin, you're getting the same bruising in your body, your colon, your liver, your brain. Yeah, that's the side effects of these things. I know the purpose of the drugs keep you from having a heart attack, but the side effects can give you ulcerative colitis, especially when you combine it with just the other drugs we've already mentioned here that cause diarrhea and that kind of thing. We got Lexapro here. What do we have with this? Diarrhea. Wow, we got how many of these? 4 or 5 now show diarrhea. Here we have loratadine for sinus congestion, sinus rhinitis, symptoms, things like that. What do we have? Can we have any diarrhea here? Let's see, palpitations, dizziness, migraines, We're going through. Oh, dyspepsia and diarrhea. Another one that can cause a multiple effect when you start adding all these drugs together that can cause that kind of thing. And prednisone, of course, your steroids makes a thin skin, your skin thin and easy bruising when you're on prednisone, when you're on these steroids. And it just you get ulcerative esophagitis, guess what? It's going to go down through your whole digestive tract. And so when you got ulcerative esophagitis, that is very bad. Impaired wound healing. So if you get any problem, it's not going to heal up very well. That is typical of steroids. And if we look around in through there, we're probably going to find diarrhea or bloody stools, peptic ulcers, that kind of thing, pancreatitis, ulcerative esophagitis. We already covered that. Impaired wound healing, thin, fragile skin. And if you got thin, fragile skin, all of your tissues are going to be thinner too. So we got more drugs like this. There's semaglutide. Oh, what do we have with that? Darkened urine, that's bad. Oh, diarrhea. There we got another one. And we got vancomycin, an oral antibiotic. And that's going to have some side effects too. I don't necessarily see diarrhea, but you see just that. And so these doctors have these patients with chronic problems. I always tell them, look at your drugs first. Now, I'm not saying that ulcerative colitis started after the drugs. I'm saying the ulcerative colitis may be worse because of the drugs and may be more resistant to all other treatments because of the drugs are like sprinkling gasoline on a fire. It's already inflamed. Then all these different drugs are just adding to the diarrhea, the inflammatory process. So you got to be thinking, what else is going on? Or, okay, they got ulcerative colitis for whatever reason. We're going to get into some of the reasons here in a minute. But some of the contributing factors, things that aggravate it, make it worse, could be the very drugs she's on right now for other conditions. All right, so let's carry on with the testing. And now the science-based nutrition report that we use and I developed basically explains everything that's in the report. And here we have Advanced Coronary Panel. It talks about some special testing, incredible testing, to get a picture of your overall health and what your heart's doing. But I want to get right into this on ulcerative colitis and make sure that this video is really geared in toward ulcerative colitis and helping you with your problems. But I want you to think it's not just your colon. People, it's just your colon. And your regular doctors are giving medications just to lower that inflammation, reduce your immune system, try and stop the bleeding, but really suppress your immune system, reduce inflammation are their main keys. But it's nothing for the cause of the problem, which we're going to get to here in just a minute. But here we are, the standard blood test that I train doctors to use. And right off the bat, well, first of all, she's not diabetic. A1C is just a tad high. I like to be at 5.6, at 5.7, nothing to worry about here. These are kidney function, and there's no sign of kidney function. Creatine is a little bit low. That could be due to low protein. But here our electrolytes all look good. Chloride, these things look good, so no problem there. The protein and albumin are low. Albumin is that part of protein that's necessary for healing and repair and regeneration, and that's low. So that will need to be addressed. Just a little quick cue. Eggs are a good source of albumin. Okay, and we're moving on now. Albumin, total bilirubin is a little bit low. That's generally not a big deal. The alkaline phosphatase is low, and alkaline phos can be as simple as zinc, magnesium, or vitamin C deficiency. Very simple. Creatine is low, it can be low protein, and your liver enzymes are high. Okay, I suspect this is from all the medications she's on. Just like all the medications can affect the colon, all those medications have to be broken down where? By the liver. And the more drugs you're on, the more your liver is going to be irritated. And an irritated liver can cause all kinds of problems. And her liver enzymes are extremely high, at least the SGPT is. And we'd like it to see to be below 26. The clinical range is 32. So extremely high liver enzymes. This is a problem. Cholesterol is high at 247. I'm not too worried about that. Her coronary risk is only 4.2. Her HDL is quite respectable at 50. Her triglycerides are at 320. That could be dietary, or it could be because the liver's inflamed. And the liver's inflamed because I believe the medications, and that's going to cause high triglycerides. Her A1C looks pretty good, so I don't think her diet is that bad. That's the beauty of looking at a complete blood test. I think with the A1C, the fact her uric acid is not high, I think her diet's pretty good. I think the triglycerides are due to a sick liver. All right, so we're going to move on with that. Not worried about the cholesterol or things like that because her coronary risk is good. Her thyroid function is optimal. Some inflammatory processes here with the antibodies, but I don't think that's contributing toward the ulcerative colitis. But we'll take care of that with what we're doing with our recommendations. Serum iron is low, clinical low, and the ferritin is low. Now, I want you to understand the color coding here. The blue is code blue. These values, if they're color-coded blue, means they are the worst. They're very low or very high. Just like code blue in a medical setting means crisis. Code blue on these labs means they're the worst. Red is danger, and yellow is warning. Anything that's red or blue will be clinical on the lab form, on the LabCorp or Quest form that you get. It'll stick out. But they're not color-coded like this report is. And so the color coding easily clues you into exactly where the problems are, the worst problems. So this patient is pretty anemic. Her red blood count is code blue low. Her hemoglobin hematocrit are also low. She is going downhill. So we're going to need to take care of the iron and nutrients to help the body rebuild blood cells. But really the key is you got to stop the ulcerative colitis because she's losing blood on a regular basis. So we've got to find the problem. And I'm going to give you some ideas on where to find a problem. We already got one, medications, but we've got more coming. Now, as we go through her labs here, we see platelets are very high, very common when the colon's involved, ulcerative colitis. This is a typical immune response, and the autoimmune disease is going to help reduce the platelets and reduce inflammation. Now, we see the CRP is normal, which is a little bit unusual in ulcerative colitis and colitis. Generally, digestive problems, the CRP goes up. So is there anything else that indicates inflammation? Oh, yes. Oh, yes. The SED rate is extremely high. Supposed to be less than 10. Clinical range is 32. It's extremely high. Indicates inflammation. Probably directly associated with the ulcerative colitis. Okay, now look at vitamin D. Extremely low. Low vitamin D, I'm not going to say it causes ulcerative colitis, but it's definitely a factor that is going to slow healing and repair. And the low vitamin D could cause a whole host of other problems that she's got. She's got hormonal problems, depression, those kind of things that could all be greatly associated with an extremely low vitamin D. And notice it's extreme low. It's 13. We want to be, I would like to be between 50 and 90. Medical is 30 to 100. But right there is where we need to be. We definitely are extremely low in vitamin D here, which causes a whole host of problems. Now, she did a hormone panel, and her hormones are all messed up. LH, FSH, testosterone, all these things, because her colon is messed up, her vitamin D is low, she's low in protein, and she's got all these drugs. And I guarantee you, all these prednisone is going to wreck your hormones. Definitely prednisone. Any of those drugs is going to affect that are hormone related or reduce the immune system is going to in some way affect the hormones. So we see a lot of blue there. Again, that's not primary. It's just a result of the ulcerative colitis and the low vitamin D, the low protein, and the drug she's on. Okay, so we got some work to do here. This is the cancer panel right here. Cancer panel looks pretty good. The DHEA is very low. Not worried about that. It's probably associated with low testosterone and low protein and low vitamin D. But she's not having any signs of cancer here. That's very good. And we move on down the advanced coronary panel. And you see some code blues here and this kind of thing. Now, I'm not going to explain in detail what those are because you can scroll back up into the report and it will explain every test that's red, yellow, or blue. So if you've forgotten, and it will correlate how it affects how these things are associated with the symptoms she has, maybe even the medication she's on. So the colored report makes your life a lot easier, and this SBN report explains everything. Everything you need to know about each test, red, yellow, or blue, is explained in the report. Okay, so we see a lot of things here. The dipstick urine test shows the pH is a little bit low, maybe need a little more water, a little more protein, that kind of thing, but nothing critical here. So I looked at this information. And now we're going to go back to the question that the doctor asked me on the ticket. Now we call it's like an email system, HIPAA compliant email system. We call it the ticket system. And so Dr. Brian had the comment about the patient, which we already covered here. Now my response, again, this was just a few weeks ago. Here's what I recommend. Do the Fresh Start diet. Do the Fresh Start diet, inflammatory diet. That is in the SBN Science-Based Nutrition Materials. We have a protocol just for such severe problems that has been very effective. And we developed this Fresh Start diet probably about 40 years ago when I first started doing nutrition. I wanted something that was very easy. I'm going to go over that Fresh Start diet here in just a minute. That would be very helpful for people with the worst severe digestive problems, that they can get food and things into them that's going to really nourish the body and take stress off the body and help it to be very easily digested and assimilated and absorbed into your system. So I'm going to show you that. So we want to start with that. Now I told them to hold off on the vitamin regimen now because this ulcerative colitis is so inflamed. If the patient would have come to my clinic here, I wouldn't have put them on that extensive vitamin protocol yet because we got to get the GI system improved so it's not so inflamed. And so we'll put them on this Fresh Start diet, which is very nutritious, by the way, and a few nutrients to aid in digestion, some enzymes, proteolytic enzymes, and probiotics. So we're going to do things to assist the body's natural digestion process. Okay, so I made those recommendations. There's a couple other things that sometimes we recommend. I told them to hold off on that. And basically just do the Fresh Start diet for at least a week, maybe two. And a lot of people feel so good on this Fresh Start diet. It really helps clean the liver out, the kidneys, the body. And some people just feel like doing it every month. They do it for a week. And some people stay on it for a week or two right off the bat. But I can't think of a single ulcerative colitis, Crohn's disease case that this special diet didn't improve. And again, we're looking at here in just a minute. But I want to go through this some more things here. One of the things here, I talked to Dr. Brian, and I lecture about this. And he's attended one of my lectures. And I said, don't know if you remember, but a lot of ulcerative colitis patients have toxic elements, especially arsenic. Now, one of the best ways to determine arsenic is the hair. And the hair will tell you the exposure you've had over a period of time. So we want you to cut the hair about that close to the scalp and about that much hair. And it'll give us generally a 4 to 6 month exposure rate. And it does pretty much easily come out in the hair. There's some other testing we might do. If we see it positive in the hair, we may do a serum arsenic level. Because if you got arsenic in the blood, generally that's within a day or two exposure. Arsenic is so toxic to the body that the body tries to put it in a safe place very quickly because that high arsenic would destroy the kidneys, cause ulcerative colitis, it causes tissue breakdown, very bad stuff. Okay, so arsenic is a key one, but there's other heavy metals that can be contributory too. Arsenic is the one that tends to be closest to the symptoms of arsenic toxicity are virtually the same as ulcerative colitis. Let me say that again. The symptoms of arsenic toxicity is virtually the same as ulcerative colitis. I'm going to talk about a couple cases other than this one here in just a minute. So we got tests for that. And sometimes we're going to do a special, what we call the urinary toxic element challenge to see if the body is able to easily eliminate heavy metals. Because sometimes things don't show up in the hair because they have an inability to efficiently eliminate that toxic element. So we will do a toxic element challenge. But that's one of the tests we commonly do on people with the most severe problems and virtually everybody with autoimmune disease problems, neurological problems, Parkinson's, Alzheimer's, autism, ADD. We commonly do this urinary toxic element challenge to see if this person has an impaired ability to eliminate heavy metals. Okay, now I want to go to the Fresh Start diet. Okay, now this Fresh Start diet, as I said before, is something I put together about 40 years ago when I first started doing nutrition, gotten into practice. It's an easy way, again, to help patients with severe digestive problems. But you know something? We use it for more than just severe digestive problems. If people just aren't getting better, we got them on a good diet, they're eating right, they're taking vitamins, and they just aren't getting better. They can't get over the hump. They're just struggling. Maybe they can't lose weight. They go on this program, I guarantee you they're going to lose weight. They will lose weight on this program, and they will feel better. But let's read about it. This temporary eating program is designed to help take stress off your digestive tract. You know, if your ankle hurts, you use crutches. Well, we need to take some stress off of your digestive tract. And we're going to make up a lot of vegetable broth, which we'll explain what that is a little bit later. And make up the vegetable broth, drink a lot of this. And so what to expect when you start doing this? Well, the first day you may feel slight discomfort by having changed your regular mode of eating. You're not used to eating like this. You're not used to eating healthy. But do not allow us to disturb you. It is natural. About the third or fourth day, the bowels and kidneys will begin to move freely. As a result of the cleansing process, you may experience some symptoms of headaches, perhaps nausea, gas, a few aches and pains. Do not be alarmed, because these could also be if you're stopping coffee, if you're off your artificial sweeteners, your Diet Coke, your Diet Pop, if you're off your junk food. Your body's not used to all this healthy stuff, and you might feel worse for a few days. These symptoms are quite natural. I just laugh because I think your body's not used to getting all this healthy stuff. It kind of freaks out. And about the fifth day, you'll start to feel a surge of energy. You'll start to feel lighter. It's like, wow, I feel great. That's expected. And if you start the program, stick to it. Okay, you might feel crappy for a few days as you get off your caffeine, your artificial sweeteners, and your junk food. But you need to discipline yourself and follow this if you truly want to get healthier, because this is actually you learning how to take care of yourself better. This is you taking the discipline to take responsibility. Rather than just going to your medical doctor and taking a drug, oh, take this drug and that drug, and you just keep eating the crap you're doing, you're never going to get better. Or if you're exposed to arsenic, you're never going to get better if you don't find it. Okay, did you hear that? I don't care what vitamins you take, what drugs you take, if you're being exposed to arsenic, you're never going to get better. And let me predict, you will end up with a colostomy. Yeah, Yeah, you'll end up with a colostomy. There's a boy, years ago, 15 years of age. He was in the hospital. He's had ulcerative colitis for several years. Yeah, at 15. And they decided it's time to take his colon out because he wasn't getting any better. He was losing blood. And they thought, well, that's the organ. It's all inflamed. Let's get rid of it. And the grandmother was a patient of ours. And she wondered what we could do because he's going to be in the hospital. He's got to stabilize a little bit before he can take the colon out. So we had him get a hair test, and we looked at blood work, and we got the hair test in. Now, let's say you got the hair test chart, and you've got a little bit arsenic, medium arsenic, a lot of arsenic. He was 3 times off the chart in arsenic. He was being poisoned, exposed to arsenic at extreme high levels. And remember when I said the symptoms of arsenic toxicity is exactly the same as ulcerative colitis and Crohn's? Yeah, ulcerative colitis. And so I showed the report and said to the grandmother, here's the findings. It's arsenic that's causing his ulcerative colitis. We've seen this many times in people with ulcerative colitis. Many times we've seen ulcerative colitis be due to arsenic poisoning. And the grandmother took the report into the medical doctor. Wouldn't even look at it. And the parents believed the medical doctor and totally dismissed it. And the boy had his colon removed. All unnecessary. Truly, I've seen people ready to have their colon taken out. We've been able to reverse everyone. Everyone. Because we did some testing to find out why it's doing it. Why it's doing it. Let me give you a story, which actually the doctor did a testimony about the work he does with SBN. In fact, he became a member and utilized the SBN report because his front desk staff lady had ulcerative colitis. And ulcerative colitis, he didn't want his staff to go on the drugs for ulcerative colitis because they suppress the immune system, and every immunosuppressive drug causes cancer. Look at the side effects. The side effects of all those immunosuppressive drugs, one of the side effects is cancer. And he didn't want his front desk staff to get cancer or get the colon taken out. So the doctor got her tested following the guidelines I did, and in just a few weeks, ulcerative colitis was gone. Now, the medical doctor, gastroenterologist, was a patient of the doctor who works with SBN, works with me, and consulted with me about this patient. And that medical doctor, gastroenterologist, said you can't cure ulcerative colitis. But the doctor did. They couldn't find any more signs of ulcerative colitis after just a few weeks, following the proper protocol. Now, what caused that? Well, this front desk lady had extreme high levels of arsenic. Now, where do you get arsenic? Okay, here's some additional notes that I want you to be aware of with arsenic. Now, where do you get arsenic? Arsenic is used in orchards. It's been used as a pesticide. In fact, the United States used more arsenic than anywhere else in the world because it was a potent pesticide. It kills pests. It was outlawed back in, I think, 1970 or 80. It was outlawed. But those orchards and farmland had arsenic in it for years. Dozens and dozens of years. And the arsenic is still there. Which means even if it's an organic orchard, organic just means it hasn't had any synthetic chemicals, herbicides, pesticides, or fertilizers for 3 years. But doesn't tell you what's in the soil. And arsenic is in these orchards that have been around for 100 years. They're loaded with arsenic. They are. It's just in the soil. And if you have wood was treated with arsenic because it kept out bugs. So treated lumber, there's a lot of arsenic around. Pesticides, even now, rat poison is arsenic. And there's just a lot of arsenic. And where this doctor, this front desk lady lived, after started working with us, he found that arsenic is kind of common. in that part of the country, in his city, in his state. And when you start doing this type of work, you'll see, oh, this community has this one has that, and you'll see different things in the environment. And so arsenic, how do you take care of the arsenic? Now, a lot of the arsenic is in the water. If you're drinking well water or city water, it can have arsenic in it. So what I recommend is use RO drinking water. Get an RO filter. You can get these at Home Depot, Lowe's. You get them online. They're relatively inexpensive, but get a good RO system because the RO, reverse osmosis, gives us the cleanest, purest water we have in technology today. So get a good RO system, and there's some 4 or 5 stage filter ones, things like that. An air filter, because it's in the dust. If you're around farming and orchards or dust, you want to breathe as clean air as possible. A lot of contaminants we get in through breathing. And so industries, orchards are a place where you get arsenic. Now I want to talk about other things associated with Crohn's. Stress. I have a family member that for years he had extreme stress and he had Crohn's, ulcerative colitis. And he was a school teacher, worked at the school, and he was under such extreme stress that was what's causing his ulcerative colitis. I had another good friend, and she was a teacher, and teaching stressed her out so much that that's why she had ulcerative colitis. Both those cases, the ulcerative colitis stopped when they quit their job. So mental stress and physical stress can cause ulcerative colitis. So it's one of the things, okay, I tend to look at drugs, chemicals, arsenic, and those kind of things. But physical stress can absolutely cause ulcerative colitis. I've known a couple that have had extreme stress. And they just happened to be teachers that was causing ulcerative colitis. And it quit when they stopped teaching. Okay, there's a young girl, 6 years of age, became a patient about 16 years ago. And her mother told us she was born with a congenital defect of the colon. She's 6 years of age, has had 8 surgeries. She has had 8 surgeries and now has no bowel control. The mother says she brings her panties home several times a week. She can't run and play because she has no bowel control. And I was talking to her on a Monday, and the mother told me that weekend that she's supposed to go to the pediatric children's hospital in Cincinnati, which she said is the largest pediatric colorectal center in the country. She said kids from all over the country are there with severe gastrointestinal colorectal problems, and her daughter has one of the worst they've ever seen. And they said it's congenital defect, 8 surgeries, has no bowel control. And the mother said that weekend she's supposed to go to that hospital in Cincinnati to learn how to care for colostomy on a 6-year-old girl. The best the medicine has to offer after multiple surgeries is take the colon out. Wow. I can't imagine how devastating it was. Oh, they tried to tell the family, oh, it's not a big deal. A lot of people have a colon removed. They have a colostomy bag. It's not a big deal. Well, if it's not such a big deal, why don't you get one? I thought it was horrifying to think of doing a colostomy on a 6-year-old. So I talked to her, and we did the testing. And we got all the testing done. And I went over it with the patient, but there's also something also unique about this 6-year-old girl. When she walked in, she had this huge distended belly. It looked like she was pregnant if she were taller. It looks like she had a huge distended belly. And I asked the mother, did that pediatric center in Cincinnati, the hospital, ever once mention diet and eating differently? No, never. I said, never in 6 years have they said anything about a diet modification or diet change? No, never. Well, I did the testing I needed, did the exams I needed, and I put her on a program. I told her to delay going to the hospital. Let's see what happens. Let's see what I can do if I just get the body healthier. And so We did. I made a complete recommendation, guidelines, foods, diet, everything, vitamins, everything to follow. And they were open to that, and they did it. And in 2 weeks, she has started having normal bowel movements. In 2 weeks, started having normal bowel movements. By 2 months, she's completely back to normal. And that was 16 years ago. She's now in college. I think she's 22, maybe 23 years of age, in perfect health, doesn't have any problems. But what would her life have been like if she'd had a colostomy? The mother took that child back to the children's center when the girl was well and healthy, and guess what? They didn't want anything. They didn't want to know. I think that is evil. Absolutely think it's evil to be willing to take a 6-year-old girl's colon out and then not want to know what fixed it. That is absolutely evil. Now I'm going to tell you what we found, or what I believe caused the problem. But during that first 2 weeks, during the first 2 months, the mother said, would actually text me. She played outside for 3 hours without an accident. She'd text me, parents and teachers are asking, what happened to your little girl? She's funny now. She's playing and silly and goofy like normal kids now. She used to be really shy and quiet. Can you imagine how that problem affected her mental development, knowing that if she ran and played, she'd have an accident? And then just getting her fixed. I remember asking her, when I saw her again in 2 months, and she's doing really well, I know it's hard for her to follow a diet. For a 6-year-old to be on this very strict diet. And I said, how hard is it to follow the diet? And I remember this so clearly. She said, I'll do anything to be normal. So, I didn't say you're never going to, I didn't tell her I'm going to fix it. I didn't tell her you're never going to need a colostomy. I said, let's get you healthy. And my motto is, the name of my clinic here in Dayton, Ohio is Take Two Healthcare. My motto slogan is take 2 weeks or 2 months to try a safe, natural option, because even serious problems sometimes have simple, safe solutions. And she gave me the 2 weeks. Her daughter was better. She gave me 2 months. Her daughter is well. And 16 years later, her daughter is still fine. Has no problems with her digestion or colon or anything. So what do I think it was? I believe for this little girl at 6 years of age, she had a glyphosate toxicity problem. It's an herbicide. It is a desiccant. It is sprayed even on organic produce because it reduces moisture. It reduces mold and bacteria. Farmers use it to help dry their fields faster, so they don't have to put it in a grain bin and use fuel, gas, or whatever to dry it. They just spray it over the field, and it makes the crops dry out faster. It makes them ripen faster. So they do that. Well, glyphosate was invented in the 70s, used more prominently in the 80s and beyond. And 90% of all corn and beans are GMO crops, and GMO crops basically mean that they can tolerate glyphosate. Roundup is what it's called. Although there's many other names for it right now. But it was called Roundup years ago. They actually said it was as safe as aspirin. So this glyphosate, I never had it when I was growing up. When I was young, it wasn't around. And so I believe I got a more tougher, robust gut because my gut grew before glyphosate was around. Now, studies show that 80% of all baby foods contaminated with glyphosate. Lots of fresh fruits and vegetables contain with glyphosate. Fast food restaurants contain with glyphosate. Roundup. So what I had this mother do is I said, you got to get only organic, local produce where you can talk to the farmer and see if it's been sprayed with glyphosate. If you can't do that, get foods, breads from Europe or New Zealand, because they don't allow glyphosate. Back then, they didn't allow any glyphosate, GMO foods. And so it was a little bit of work on the family to get foods from Europe, breads, dairy products, cheeses, butter, things like that, from Europe and New Zealand and other areas, and then to find the local areas. Now, in Dayton, Ohio, there's an Amish community around, and there are some other farms that go to the extra work to get true organic produce. It's a little more expensive, but it is far healthier. So if you can, I encourage you to support your local farmers who go to the extra work to get organic, true organic, non-glyphosate products. And the mother said, as long as she's on that diet, especially in the beginning, no problem. But she got off the diet, symptoms came back. She got off the vitamins, symptoms came back. Well, now she's older, she's developed. I'm not saying she's perfect all the time, but she has no symptoms. So we've got a few things now that we know can contribute to ulcerative colitis, and it may not just be one, it may be multiple of things. For that little girl, I believe glyphosate was the primary thing. Glyphosate, without doubt, was the primary thing. And it caused gastrointestinal problems. Glyphosate is horrible for animals. Lots of problems with glyphosate. And children, I believe, have autoimmune diseases and digestive problems, even other problems because of such high exposure to chemicals in glyphosate when they're very young. Okay, so glyphosate, stress I talked about, and I believe one of the biggest ones is arsenic. Arsenic. Now, it could be other heavy metals, and it could be a combination of things. And remember another one I talked about right in the beginning? Drugs. Yes, drugs can cause ulcerative colitis symptoms. Now, maybe a combination of things. And just because you didn't have it for most of your life and then you develop it, you got to look at what's different. Well, I've been on these drugs for 10 years. Doesn't matter. The effect of drugs are cumulative and progressive. The effect on your liver is constant, and your liver is getting weaker the longer you are on any drug. Your immune system is weaker. The more drugs you're on, the more your immune system, your liver, your kidneys are under stress, making your system weaker. Okay, so you've got ulcerative colitis. What I'd recommend you do, find a doctor, pardon my humility, that I've trained. And we've trained hundreds. You can contact our science-based nutrition center, and we can try and find a doctor in your area. But I would desperately recommend you not submit to a colostomy until you've seen someone like me who knows what they're doing and who is interested in helping you get well. Let me just tell you a tragic story here. One of the doctors who heard this story about the little girl with looking at colostomy at 6 years of age and all that, he told me 2 weeks before he attended my class that there's a high school dance and a 15-year-old girl that had a colostomy. It burst during the dance and she went home and committed suicide. Another doctor said his best friend when he was in high school had a colostomy at age 17. And he always wanted to join the military. Always wanted to join the military. You can't join the military with a colostomy, and he jumped off a bridge. How many lives are damaged forever, permanently? Oh, they'll say, oh, you can live with it. Yeah, what kind of life are you going to have? You know, the girl now who actually I see fairly commonly, almost every month in business, because she's around the area where I live. What would her life have been like if she had a colostomy going up through grade school, junior high, high school? Would she have had a boyfriend? What are her odds of then getting married and having children with this colostomy? All gone because her mother decided to try something different. Even though the experts, the medical experts, the best they had to offer was a colostomy, she wanted something better for her daughter. And she just wanted to give us 2 weeks and 2 months, and now I don't know how many years, 16, 17 years later, she's alive and well because we found the problem. So if you've got ulcerative colitis, don't despair, don't give up hope. I honestly have not seen a single ulcerative colitis case that hasn't dramatically improved. I'd say most of them go into complete remission because we find what's causing the problem. We're not treating the symptom like your medical doctor is with drugs. We're finding the cause. If we find the cause, truly find the cause, and we have compliance, you comply with what we recommend, usually dramatic results in just a few days. Hope that gives you encouragement. Don't despair. Keep looking. There is a solution for your problem, and we'd be happy to help you. I believe we can We can find it. You just got to give us a chance. Have a great day, everyone. I'm Dr. Merkle.